I'm about to show you something that changes everything you think you know about high blood pressure. Something your doctor has never told you. Something that explains why nothing you've tried has actually worked. I'm Dr. Megan Foster, and after 24 years in clinical practice, I've watched thousands of people struggle with blood pressure numbers that won't budge no matter what they do. They cut salt, they take their pills, they walk every day, and still, the numbers stay high. Still, the fear grows. Still, they're told they need more medication, lower numbers, constant monitoring, and nobody, not one doctor, explains why this is happening. Here's what I discovered after 2 decades of seeing this pattern repeat over and over. The entire way we've been taught to think about blood pressure is wrong. It's not what you think it is. It's not about the things you've been told to fix. And that's why nothing has worked. Because you've been fighting the wrong battle. In the next few minutes, I'm going to explain what high blood pressure actually is at the level most doctors never learn. I'm going to show you why the standard approach fails. And I'm going to give you a completely different framework, one that actually makes sense of what's happening in your body and what genuinely helps. This isn't another lecture about salt and stress. This is different. Stay with me. Before we go any further, I need to say this clearly. I'm a physician, but I'm not your physician. Nothing in this video is medical advice for your specific situation. If you're on blood pressure medication, if you have heart disease, kidney disease, diabetes, or any other condition, you need to work directly with your own healthcare provider. Do not stop or change medications based on anything you hear today. This is education, this is context, but your individual care needs to stay between you and your doctor. That said, what I'm sharing today is grounded in clinical research, in randomized controlled trials, in what we understand about cardiovascular physiology, and I think it's going to help you make sense of what's happening in your body. Here's the thing most people are never told. The problem with high blood pressure isn't just the number on the monitor, it's how your body regulates pressure over time. Blood pressure is not a fixed thing, it's dynamic. It moves throughout the day, responding to what you eat, how you move, how you breathe, whether you're stressed or calm, whether you're awake or asleep. And that variability, those spikes, that's what matters most. A single reading in a doctor's office doesn't tell the full story. What we're really looking at is whether your cardiovascular system can regulate pressure smoothly or whether it's constantly overreacting, constantly spiking, constantly running too high. And that's the key insight for everything we're going to talk about today. We're not just trying to force a number down, we're trying to support the system that controls blood pressure in the first place. Now, what does that actually mean for you? What can you expect if you start thinking about blood pressure this way? First, more stable readings. You're not chasing numbers that bounce all over the place, you're seeing consistency. Second, fewer scary spikes. Those moments where you check your pressure and it's suddenly 160 over 95 and your heart sinks, those start to happen less often. Third, less anxiety around the cuff itself. Because you're not treating every reading like a verdict, you understand what's normal, what's noise, and what actually needs attention. Fourth, better tolerance of daily stress. Your body doesn't overreact as much. You get cut off in traffic, you have a hard conversation, and your pressure doesn't skyrocket the way it used to. And fifth, confidence. Confidence in what actually helps. Not the latest influencer trend, not the panic driven advice, but the stuff that's backed by real evidence and real clinical outcomes. And I want to be clear about the tone of all of this. What I'm going to share is practical, it's gradual, it's protective. I'm not going to tell you that you can reverse hypertension in 30 days, or that you should throw away your medications, or that there's one magic food that fixes everything. That's not how this works. But what I am going to tell you is that there are specific evidence based strategies that help your body regulate blood pressure more effectively. And those strategies are things you can actually do. So let me give you some context about where this comes from. Over more than 2 decades of clinical practice, I've worked with thousands of patients who have high blood pressure. And so many of them come in doing everything right. They're eating salads, they're walking every day, they've cut out salt, they're taking their medications exactly as prescribed, and their blood pressure still isn't where they want it to be, or it's controlled, but they feel terrible. They're dizzy, they're tired, they can't think clearly. And nobody's explaining why. That gap, that disconnect between effort and outcome, That's what I want to close today. Because when you understand how blood pressure regulation actually works, you stop spinning your wheels. You stop doing things that don't matter, and you start focusing on what does. All right, let's talk about the first big piece of this puzzle: vascular flexibility. Your arteries are not pipes. I know that's the mental image a lot of people have. Blood pressure goes up, it's like turning up the water pressure in a pipe. But that's not accurate. Your arteries are living tissue. They're made of smooth muscle, they're lined with endothelial cells, and they're supposed to be flexible. When your heart beats and sends a surge of blood into your arteries, those arteries are supposed to expand slightly to accommodate that surge. Then they recoil. That flexibility cushions the pressure wave. It keeps the force from slamming into your organs with every heartbeat. But over time, arteries can become stiff. They lose that flexibility. And when that happens, the same amount of blood from the same heartbeat creates higher pressure. Same heart, different vessel response. That's why two people with similar heart function can have very different blood pressure readings. One person's arteries are flexible, the other person's are stiff. And stiffness drives up systolic pressure, that top number in particular. So, what causes stiffness? A few things: chronic inflammation, oxidative stress, endothelial dysfunction, high blood sugar over time, lack of physical activity, smoking. And yes, aging plays a role, but it's not inevitable. There are 70-year-olds with beautifully flexible arteries and 50-year-olds with stiff ones. It depends on how those arteries have been treated over the years. And here's the good news: vascular flexibility can improve. It's not a one-way street. There are interventions that genuinely help arteries become more compliant again. Let me give you an example. I had a patient, mid 60s, retired teacher, came in with blood pressure consistently running around 150 over 90. Not severe, but not where we wanted it. She was already on medication. We talked about her lifestyle. She was eating pretty well, low sodium, lots of vegetables. But she wasn't moving much. She'd had knee pain for years and had just gotten out of the habit of exercise. We started with walking, just 15 minutes after breakfast, 15 minutes after dinner. Nothing intense, just consistent movement. Within 3 months, her systolic pressure dropped by 12 points. We didn't change her medication. We didn't overhaul her diet. Her arteries just started responding better. And that's what happens when you improve vascular flexibility. The same heart, the same blood volume, but the vessels handle it more smoothly. What helps with vascular flexibility? Exercise is probably the most powerful tool we have, and it doesn't have to be extreme. Moderate intensity aerobic exercise, the kind where you can still hold a conversation but you're breathing a little harder, that stimulates nitric oxide production in the endothelium. Nitric oxide is a signaling molecule that tells blood vessels to relax. It improves blood flow, reduces stiffness, and, over time, it remodels the arterial wall in a healthier direction. Studies show that even short bouts of exercise, 10 to 15 minutes at a time, have measurable effects on blood pressure. You don't need to run marathons, you need consistency. Potassium also plays a role here. Potassium helps balance sodium, yes, but it also directly affects vascular smooth muscle tone. When you have adequate potassium, your blood vessels are more responsive, more able to dilate when needed. And most people don't get enough potassium. The recommended intake is around 4,700 milligrams a day, and most adults get maybe half that. Where do you get potassium? Fruits, vegetables, beans, potatoes, fish, whole foods. Not supplements unless your doctor specifically recommends them, because potassium supplements can be risky if you have kidney issues or if you're on certain medications. And then there's time. Vascular remodeling doesn't happen overnight. If your arteries have been stiff for years, they're not going to become flexible again in 2 weeks. It takes months. But the timeline matters because it gives you permission to be patient. You're not failing if your blood pressure doesn't drop immediately. You're building a foundation. Now, let's talk about sodium. And I'm going to say something that might surprise you. Sodium is not the enemy. I know that goes against everything you've heard. Cut salt, lower your blood pressure. And yes, for some people, sodium restriction helps. But not everyone is sodium sensitive. There are people who can eat a high sodium diet and their blood pressure doesn't budge, and there are people who cut sodium to almost nothing and they still struggle. So, what's the difference? Sodium sensitivity is influenced by genetics, by kidney function, by insulin levels, by the gut microbiome, by a bunch of factors we're still figuring out. But here's what we do know: the ratio of potassium to sodium matters more than sodium alone. If you're eating a lot of sodium, but also a lot of potassium, your body handles it better. The kidneys can excrete the excess sodium more efficiently, and the blood vessels don't constrict as much in response. But if you're eating a lot of sodium and very little potassium, that's when problems arise. And that's the pattern in most processed foods: high sodium, low potassium. Packaged snacks, frozen meals, restaurant food, fast food. The sodium load is huge and there's almost no potassium to balance it out. So, when I talk to patients about sodium, I don't tell them to eliminate salt. I tell them to think about where their sodium is coming from. Are you salting your home cooked vegetables? That's probably fine. Are you eating out 5 times a week and having chips and deli meat and canned soup? That's a different story. The goal is not zero sodium. The goal is a reasonable sodium intake in the context of a potassium rich diet. And for most people, that means cooking more at home and eating more whole foods. Not because salt is evil, but because processed food is nutritionally imbalanced. Let me share another clinical example. I worked with a guy in his 50s, truck driver. Blood pressure was creeping up over the years, got to the point where we started medication. He was convinced salt was the problem. He cut it out completely, stopped salting anything, avoided anything with sodium on the label, and his blood pressure didn't improve. He came back frustrated, feeling like he'd done everything, and it didn't work. So we looked at his overall diet. He was eating a lot of low sodium processed food, low sodium crackers, low sodium frozen dinners, but still almost no vegetables, no fruit, no beans. His potassium intake was extremely low. So we shifted focus, added a banana and some spinach to his breakfast, added a sweet potato and some broccoli to his dinner. Kept his sodium intake reasonable, not excessive, but not restrictive. Within 6 weeks, his blood pressure started coming down. Not because we cut sodium further, but because we balanced the system. There's another piece of this that most people are never told: stress and nervous system load. You can have a perfect diet, you can exercise every day, and if your nervous system is stuck in fight or flight mode, your blood pressure is going to stay high. Here's why. Your autonomic nervous system has two branches: sympathetic, which is your stress response, and parasympathetic, which is your rest and recovery response. Sympathetic activation raises heart rate, constricts blood vessels, and increases blood pressure. That's useful if you're running from danger. But if your sympathetic nervous system is chronically activated because you're stressed at work, or you're not sleeping well, or you're anxious all the time, your blood pressure stays elevated even when you're sitting on the couch. And this is where a lot of people get stuck. They're doing all the physical interventions, diet and exercise, but they're not addressing the nervous system piece. And the nervous system piece is huge. There are studies using ambulatory blood pressure monitoring where people wear a cuff that measures their pressure every 20 or 30 minutes throughout the day and night. And what those studies show is that people with high stress levels have more blood pressure variability. They spike higher during the day, they don't dip as much at night, and their average pressure is higher overall. Even if their resting blood pressure in a calm moment looks okay, the moment they're under stress, it skyrockets. So, what do you do about that? A few things. First, breathing. Slow, deep breathing activates the parasympathetic nervous system. It signals your body that you're safe. There are clinical trials showing that paced breathing, usually around 6 breaths per minute, can lower blood pressure by several points after just a few weeks of daily practice. It doesn't have to be complicated. You don't need an app. You just need to breathe slowly and deliberately for 5 or 10 minutes a day. That's it. Second, sleep. Poor sleep drives sympathetic activation. If you're not getting enough sleep, or if your sleep is fragmented, your body stays in a higher alert state, and that raises blood pressure. There's actually a term for it: non-dipping. Normally, blood pressure should drop by 10 to 20% during sleep. That's called dipping. But some people don't dip. Their nighttime pressure stays almost as high as their daytime pressure. And non-dipping is associated with worse cardiovascular outcomes. It means your body isn't recovering overnight. So, improving sleep quality. Whether that's through better sleep hygiene or addressing sleep apnea or managing insomnia, that's a blood pressure intervention. And third, managing chronic stress. I'm not going to pretend that you can just eliminate stress from your life, but you can change how your body responds to it. Regular physical activity helps, social connection helps, time in nature helps. Therapy or counseling can help if you're dealing with anxiety or trauma. The point is not to avoid stress completely. The point is to give your nervous system a chance to reset, to spend more time in parasympathetic mode so it's not constantly running hot. Now, let's talk about movement, but in a specific way, because I think a lot of people hear exercise for blood pressure and they picture intense workouts. But that's not what the research shows is most effective. What the research shows is that timing and consistency matter more than intensity. Short walks, 10 to 15 minutes, reduce systolic blood pressure, especially if you do them after meals or in the evening. Why? Because movement helps regulate blood sugar, and blood sugar affects blood pressure. When you eat, your blood sugar rises. If it rises too much or stays elevated too long, it triggers insulin release, and insulin causes the kidneys to retain sodium. More sodium retention means more fluid in your bloodstream, which raises blood pressure. But if you move after eating, even just a gentle walk, your muscles take up glucose without needing as much insulin. Blood sugar stays more stable, insulin stays lower, and you avoid that sodium retention spike. There's a study that looked at this specifically. They had people with elevated blood pressure walk for just 10 minutes after each meal. No other changes. And over the course of a few weeks, their systolic blood pressure dropped by an average of 7 points. That's comparable to some medications. And it's from 10-minute walks, not boot camp, not running, just walking. Evening walks also seem to have a particular benefit. There's something about moving in the early evening, maybe an hour or two before bed, that improves nighttime blood pressure. It helps with that dipping pattern I mentioned earlier. Your body enters sleep in a calmer state, and your blood pressure drops more like it's supposed to. I've seen this clinically over and over. Patients who start taking an evening walk, even if they're already exercising in the morning, their nighttime blood pressure improves. And they often sleep better too, which compounds the benefit. So if you're thinking about what to do differently starting today, this is one of the easiest wins. A short walk after dinner. You don't need special shoes, you don't need a gym, you don't need to carve out a big chunk of time. Just 10 or 15 minutes, ideally most days of the week. The consistency is what matters. Your body learns to expect it and it starts to respond. Let's move to meal timing because this is another one of those hidden factors that almost nobody talks about. When you eat matters for blood pressure. Not just what you eat, but when. And the reason has to do with circadian rhythms and insulin sensitivity. Your body is more insulin sensitive earlier in the day. That means the same meal, eaten at breakfast or lunch, requires less insulin to process than if you ate it at dinner or later at night. And remember, insulin causes sodium retention. So eating late, especially eating large or carbohydrate heavy meals late, drives insulin up at a time when your body is already shifting into nighttime physiology. And that raises overnight blood pressure. There's research using continuous glucose monitors and ambulatory blood pressure monitors that shows this clearly. People who eat dinner late or who snack in the evening have higher nighttime blood pressure. They also have more blood pressure variability. Their body is trying to digest food and regulate blood sugar at a time when it's supposed to be winding down, and the result is poor blood pressure control overnight. Whereas people who finish eating earlier, say by 7 or 8 p.m., have lower nighttime pressure and better dipping. Now, I know this is hard. Modern life doesn't make it easy to eat early. People get home late, they're tired, dinner gets pushed back. But even small shifts help. If you're currently eating at 9 p.m., try for 8:30. Then 8. You don't have to be perfect. You're just aiming for earlier rather than later most nights. And if you do eat late occasionally, don't panic. It's the pattern that matters, not one meal. There's also the question of meal size. Large meals, especially large dinners, are harder for your body to process. They require more insulin, they raise blood sugar more, and they can trigger a stress response. Smaller, more frequent meals tend to keep blood sugar and insulin more stable throughout the day, which helps blood pressure. But again, this has to fit your life. If eating smaller meals feels restrictive or stressful, it's not worth it. The goal is to find a pattern that supports your physiology without creating new problems. All right, now we need to talk about alcohol. And I know this is one people don't always want to hear, but the evidence is really clear. Alcohol raises blood pressure, even at moderate levels. We're not just talking about heavy drinking. We're talking about 2 drinks a day, sometimes even 1 drink a day, depending on the person. And the effect is particularly pronounced on nighttime blood pressure. You might have a glass of wine with dinner, you feel relaxed, you go to bed, and you assume everything's fine. But what's happening overnight is that your blood pressure isn't dipping the way it should. Alcohol disrupts sleep architecture. It fragments your sleep. It increases sympathetic nervous system activity in the second half of the night, and all of that keeps blood pressure elevated. There are studies that have looked at people who drink regularly and then stop, even temporarily, and their blood pressure drops within days, not weeks, not months. Days. For some people, cutting out alcohol entirely is one of the most effective blood pressure interventions they can make. And I'm not here to tell you that you should never drink. That's a personal choice, but if you have high blood pressure and you're drinking regularly, even moderately, it's worth knowing that it's likely contributing. And if you're willing to experiment, try going without alcohol for 2 or 3 weeks and see what happens to your blood pressure. You might be surprised. Now, let's talk about medications because I think there's a lot of confusion and fear around this. First, taking blood pressure medication is not a failure. It's not a sign that you didn't try hard enough or that you're broken. For some people, lifestyle changes alone are enough to control blood pressure. For other people, they're not, and that's okay. Medications can be life saving. They reduce the risk of stroke, heart attack, heart failure, kidney disease. They protect your organs, and if you need them, you should take them. But here's the part that I think gets missed. Medications need to be tailored to the individual. What works for one person might not work for another. And more importantly, overtreatment is a real risk, especially in older adults. There's this idea that lower is always better, that we should push blood pressure down as far as possible. But that's not true. If your blood pressure is too low, you can have problems. Dizziness, falls, fractures, fatigue, poor concentration, kidney dysfunction. And for older adults, the risks of overtreatment can outweigh the benefits. There was a major trial called SPRINT that looked at intensive blood pressure lowering, targeting systolic pressure below 120. And yes, it showed benefits for certain high risk patients, but it also showed increased risks of hypotension, syncope, electrolyte abnormalities, and acute kidney injury. And importantly, the trial excluded people over 80, people with diabetes, people with prior stroke, and people who were frail. So the results don't necessarily apply to everyone. Yet the message that got out was lower is always better. And that's led to a lot of people being overtreated. So, what does this mean for you? It means that if you're on blood pressure medication and you're feeling terrible, dizzy, exhausted, can't think straight, you need to talk to your doctor. Your blood pressure might be too low. If you're checking your pressure at home and it's consistently running in the 90s over 60s or the low 100s over 60s, and you're symptomatic, that's a conversation to have. Medications can be adjusted, doses can be lowered, sometimes medications can be stopped, especially if you've made significant lifestyle changes. But you have to do that with your doctor, not on your own. Stopping blood pressure medication abruptly can cause rebound hypertension, where your pressure spikes dangerously high. So it has to be done gradually and carefully. And here's the other thing. Monitoring symptoms is just as important as monitoring numbers. How do you feel? Can you stand up without getting dizzy? Can you think clearly? Can you exercise without feeling wiped out? Those are markers of whether your treatment is appropriate. Numbers matter, but they're not the only thing that matters. Let me give you a clinical story that illustrates this. I had a patient in her late 70s. She'd been on 3 blood pressure medications for years. Her pressure in the office was always well controlled, usually around 110 over 65. But she was miserable. She was dizzy every time she stood up. She was falling. She'd fractured her wrist from a fall the year before. She was scared to leave the house because she didn't trust her balance. And nobody had questioned whether her blood pressure was too low. So we did some home monitoring. Her morning pressures were in the 90s over 50s. That's too low for someone her age. We started reducing her medications one at a time, slowly. It took a few months to get the balance right, but by the end, she was on one medication instead of three. Her blood pressure was running around 130 over 70, and she felt like a different person. No more dizziness, no more falls. She could walk around her neighborhood again, and her cardiovascular risk was still well managed. We didn't need to push her pressure down to 110. That was actually harming her. So, the takeaway here is that medication management needs to be individualized. It needs to consider your age, your other health conditions, your symptoms, your functional status, and it needs to be a conversation, not a dictate. There's one more habit that quietly raises blood pressure overnight, and a lot of people don't think about it. Late night screen time. Blue light exposure in the evening suppresses melatonin. Melatonin is not just a sleep hormone, it also has cardiovascular effects. It helps regulate blood pressure, it has antioxidant properties, it supports vascular health. When you suppress melatonin by staring at screens late into the night, you're disrupting your circadian rhythm, you're interfering with your body's natural nighttime blood pressure dip, and you're making it harder for your cardiovascular system to recover overnight. There are studies showing that people who use screens heavily in the hour or two before bed have higher nighttime blood pressure and more sleep disturbances. And it's not just about sleep duration, it's about sleep quality and about the hormonal signals your body is receiving. So if you're struggling with blood pressure and you're on your phone or computer until you fall asleep, that's something to address. Dim the lights in the evening. Turn off screens an hour before bed if you can. If you can't, at least use blue light filters. Give your body a chance to produce melatonin and shift into nighttime physiology properly. Now, I want to circle back to the big insight I mentioned at the beginning. Blood pressure is not about forcing numbers down. It's about supporting how your body regulates pressure. Every single thing we've talked about today, vascular flexibility, potassium sodium balance, nervous system regulation, meal timing, movement, alcohol, medication management, all of it is about giving your cardiovascular system what it needs to function well. You're not fighting against your body, you're working with it. And that shift in mindset is huge because when you're just trying to force a number down, it feels like a battle. You're checking your pressure obsessively, you're panicking when it's high, you're restricting and controlling and stressing. But when you understand that your body wants to regulate blood pressure effectively and that your job is to support that process, it feels completely different. You're not at war, you're taking care of a system. So let's talk about what this looks like in practice. What can you actually do starting today? First, pick one thing. Don't try to overhaul everything at once. That's overwhelming and it usually doesn't stick. Pick one thing from this conversation that resonates with you. Maybe it's a short walk after dinner. Maybe it's finishing dinner earlier. Maybe it's cutting back on alcohol for a few weeks to see what happens. Maybe it's working on sleep. Whatever it is, start there. Do it consistently for a few weeks. See how your body responds. And then add something else. Second, track your blood pressure, but do it smart. Check it at the same time of day, in the same conditions, a few times a week. Not every hour. Not every time you feel anxious. You're looking for patterns, not individual readings. And don't panic over one high reading. Blood pressure spikes. That's normal. It's the overall trend that matters. Third, pay attention to how you feel. Are you less anxious? Are you sleeping better? Do you have more energy? Those are signs that your cardiovascular system is functioning better, even if the numbers haven't changed dramatically yet. And over time, the numbers will follow, but the felt experience is important. And fourth, keep learning. There's so much noise out there about blood pressure. Influencers telling you to eat this, avoid that, take this supplement, try this detox. Most of it is not evidence based, but there are good resources. If you want to understand blood pressure more deeply, look for information from medical institutions, from researchers, from clinicians who are actually treating patients, not from people selling products. I also want to mention that I'll be making more videos on specific aspects of blood pressure management. One on walking and blood pressure, because there's a lot more to say about timing and intensity and how to make it work for different fitness levels. One on nighttime blood pressure and why it matters so much for long term outcomes. One on stress versus salt, because that's a false dichotomy that confuses a lot of people. And one on why blood pressure fluctuates so much and what's normal versus what's concerning. So if those topics interest you, make sure you subscribe so you don't miss them. I'm trying to create a library of calm, evidence based, practical health information for people who are tired of being scared and confused. Before we wrap up, I want to say one more thing. If you've been living with high blood pressure for a while, if you've been scared every time you check your numbers, if you felt like you're doing everything right and it's still not enough, I want you to hear this. You are not broken. Your body is not failing. Blood pressure is complex. It's influenced by genetics, by stress, by sleep, by diet, by movement, by medications, by a dozen other factors. And sometimes it takes time to figure out what works for you. But every small change you make that supports your cardiovascular system is worth it, even if the numbers don't drop immediately. Even if it feels slow, you are building a foundation, you are reducing risk, you are taking care of yourself, and that matters. So here's what I want you to take away from this conversation. Blood pressure isn't just a number. It's a reflection of how your entire cardiovascular system is functioning, and you have more influence over that than you might think. Not through panic or restriction or obsessive monitoring, but through understanding, through consistency, through working with your body instead of against it. You can support vascular flexibility. You can balance sodium and potassium. You can calm your nervous system. You can move in ways that help. You can time your meals better. You can improve your sleep. You can make informed choices about alcohol and medications. All of these things matter, and all of these things are within your control. The goal isn't perfection, it's progress. It's feeling safer with your blood pressure instead of terrified of it. It's having more stable readings, fewer scary spikes, more confidence in what you're doing. And it's knowing that you're protecting your long term health in a way that's sustainable and based on real science, not fear. If you found this helpful, I'd appreciate it if you'd give this video a thumbs up and share it with someone who might need to hear it. There are so many people out there